Good afternoon, everyone. Good morning to you, depending on where you are. I welcome you to this CoP session, where we are going to be discussing about the rationalization of and prioritizing customs clearance for sequencing commodities. So we will be discussing the customs regulations and clearance of genomic sequencing commodities, the opportunities, the solutions, and any bottlenecks, not to overemphasize on the bottlenecks, but especially on the opportunities and solutions. So in this is our session 3 for the genomic sequencing PSCM CoP. And just to bring us to speed, I'm going to just highlight to you the agenda as projected on the screen there. We are going to be having slight changes, but we'll be checking if our presenter from Zambia has now managed to connect. Please just alert Namaka if you have now managed to connect Dr. Peter, since he was struggling to connect. So after the first presentation about the debrief from the last session, we'll then have an open discussion, and finally we'll have the key action items for follow-up as a team from the discussion. Without further ado, I will hand over this time to Namaka to brief us about the rationale for prioritizing customs clearance of GS commodities from the next slide. Namaka is with Clean Health Access Initiative. Namaka, over to you.
Okay. So, like I was saying, the genomic sequencing supply chain faces multiple challenges, with one of the most frequently cited bottlenecks being the complex importation processes at entry points. This issue is constantly raised by countries and procurement entities. And we had a bit of a discussion in our last CoP session when we were talking about MPOX, diagnostics, bottlenecks, and this thematic area really came out as being a big issue in these countries. Several factors have contributed to these complexities, including the non-standardized regulatory requirements across various African countries, the extensive documentation requirements for import permits and tax waivers, which often lead to inaccurate or incomplete applications. We also talk about high tax tariffs that drive the application for these waivers. And of course, the very lengthy approval processes by the regulatory authority or the revenue authority in approving these waivers, which then contributes to a further delay in shipments. Additionally, there is very limited awareness among its customs officials about the nature and public health importance of these sequencing commodities, which has resulted in low prioritization for the customs clearance of these commodities. And this further has increased the delivery lead times for laboratories. So these issues really have serious consequences. And when you have these commodities held up at customs, this usually leads to hindered genomic surveillance efforts, compromised product integrity due to cold storage failures. Some institutions have had high demurrage fees from prolonged custom processing time, and amongst other consequences that can really lead to loss of goods. And addressing these bottlenecks collectively and strategically as a CoP and as a continent is critical to scaling the sequencing for disease surveillance, public health interventions, and broader applications across the continent. So for today's session, we really aim to identify actionable solutions for overcoming these challenges and gather recommendations as a community and from the community, improving procurement and supply chain and customs issues for sequencing commodities. And we have various platforms in which we are trying to improve the engagement of our community. And this has included our LinkedIn page, that the link will be shared in the chat shortly. And then we have also set up a WhatsApp community group. The link will be pasted shortly by Silva in the chat. And we are also conducting a survey on the importation and customs clearance challenges in countries that we've actively shared on our LinkedIn page, but we'll also be sharing on our WhatsApp community group. So these are just basically an overview and a rationale as to why we are focusing on this particular topic today. Thank you. Nyasha, over to you.
Thank you very much, Namaka, for the opening remarks about the challenges that we face. Ladies and gentlemen, colleagues, this is a very important subject that we, as the community of practice, will definitely have valid proposed solutions for the smooth flow of commodities, which are a critical component of both research and diagnosis. We are going to take this to the point of discussion. And as earlier, for those who joined a bit late, we apologize for the failure to connect for our colleague who was supposed to present from Zambia. So we'll proceed straight to discussions. We are going to be having some questions where we are free to contribute. You allow people to raise their hands, and you can also have contributions in the chats. So our first discussion point, we want to understand your experiences importing commodities into the countries. Any good practices you have implemented that you think can be adopted in the other different countries to improve the processes for the commodities. So I give this back to the community to suggest to us any experiences that they're having and what they are experiencing in their different countries. I'll keep projecting the person for reference so that those who can share and raise their hands and share, especially from the member countries.
I think I just wanted to share some of the different examples that I have heard. And I think it's probably also important to contextualize what we're talking about. So when we look at the importation process, there's multiple different areas of that process that's a problem. So there is the customs processes themselves. There's also issues, as I understand it, with the H codes not being set up appropriately, which means then that when they go through customs, it's not necessarily going through the appropriate processes. And there's also challenges where products are where you're looking for a waiver, a tax waiver, and those internal processes within the governments can be quite challenging and lengthy. I also understand that, so we have the importation process itself, and there's certain paperwork that's required. We have duty obligations, we have tax obligations, and we have the customs processes themselves. And as I understand it, there's also challenges in regards to customs storage for products that have temperature requirements. When I was running the regional distribution warehouse in Kenya, we were bringing in vaccines from temperature-sensitive vaccines from a couple of the large pharma companies, and the customs at the time in Kenya was not very. The process was not very clear. And the storage conditions for temperature-sensitive products was not very good. So what we did with the customs agent, or with the customs, is negotiated a bond. And what we did is we placed a bond with them, and when our shipments came in, we got like I think it was like a 4-hour clearance. And then we were able to bring them to our warehouse, but then we completed the customs process afterwards, but we were at least able to move the products into our warehouse. So there's some innovative ways of trying to work with the customs. Some of the stuff that I've heard from one country is that there is, when it comes to paying the duties, even if it is tax-free, somebody still has to pay them, and there's only a certain amount of money allocated to that in the budget, and it's on a first come first serve, or it's on a if you have forecasted for it, then it's available. But if it's an unexpected donation, or if it's an unexpected procurement, and all that money has been used up, then you have to go back internally and try to secure additional financing and funding from within. And I've also heard from different manufacturers and distributors that sometimes the appropriate paperwork is not in place. So these are some of the issues that I've kind of heard, but I think it would be really important if there are some countries or manufacturers online, if they can share not just the problems that they're having, but also either solutions that they have found, or what they would recommend to the COP in terms of addressing some of these issues. Over.
Thank you very much, Maeve. I don't see any other hand up. Yes, I've got
Yeah, sure.
someone's hand up. Okay,
Yeah,
go ahead.
so I'd just like to echo Maeve's some of Maeve's points. I think one thing that we've noticed with the scoping that we've done as CHI is that it's just sometimes simply down to the process is not being known clearly. So having non-standardized processes, or the process is just not known by those that are importing, either the channel partners, the customs agents, or even the procurers themselves. And it boils down to, maybe just developing some sort of manual to kind of support marking very clearly what those processes are, and the documentation required at each stage, especially for countries where there's blanket requirements over, let's say, health commodities coming in country, donations, or commodities being used for humanitarian aid. It's a shame our presenter isn't here today, but in the case of Zambia, where they've developed a manual, although in draft form, basically looking to address, to standardize the process and to support and help other organizations that are bringing commodities into the country. So basically a very step-by-step manual that shows clear roles and responsibilities, what documentation is required at each stage, what electronic systems to use, et cetera, et cetera. And this is in hopes that these customs issues will be mitigated when it's actually implemented. Thank you.
Thank you very much. Nasif, go ahead.
Thank you for opportunity.
Can you kindly introduce yourself before you proceed?
Yes. My name is Narciso Shashwai. I'm speaking from Mozambique. We belongs for the CISME, okay, Foundation Manhissa, the government, the organization who is responsible to researching the product for health. Yes, I'm responsible for the department for exportation and importation and exportation goods. So I have not much to say, but I would like to share with you some experience for importation for the goods, for F goods. Yes, firstly, I want to tell you that we have a big challenge for this process, because sometimes supplies it doesn't have some basics or some experience to send the merchandise. In some case, we ship the parcel, the merchandise to Mozambique without complete documents. With the complete documents, it's a certificate of analysis, certificate of conformance, and the packing list and the quality certificate. Our government here in Mozambique, when the merchandise we receive in here with custom authorities requesting this document. Without this document, it will not possible to get out the merchandise with customs. And another factors, some of them effort product, and especially those that require controlled the temperatures. In Mozambique, we only have one transport agent transport that has temperature conservation conditions. If you send this merchandise without those documents, the merchandise will take a long time to get out with customs. Don't forget some conditions are important because the product are cold, but we come back to requesting the document to complete, and then we share with the customs to finalize the process. In summarize, it's important for us, for Mozambique, before you send the merchandise, to contact the importer to confirm that all documents are ready to ship or not. If you're not, you must wait the right time comes to finalize or to ship the merchandise. And while you're shipping this, you don't forget to share the all documentation that I already mentioned. It's important to clearance this with customs. Thank you for opportunity.
Thank you very much, Nakeso, for those insights. We will have our last contributor to this question, Mr. Brighton Munwa, before we go to the next discussion point. Brighton, go ahead, please.
Thank you very much. I'm Brighton Munwa. I'm a procurement specialist from Zambia. I'd like to state that I'm attending this meeting not representing my organization, but in my personal capacity as one of the people that helps to draft the document that Namwaka was referencing to earlier in the meeting. So I would like to also agree with what the previous speaker is just from saying. I think there's what we discovered was that for the Zambian situation, there was a gap in terms of the understanding of what documentation is required, some of the processes, how do you go about them. And I think as a solution for every country, it will be good to understand what the requirements are. Because I was looking at the list of challenges like lack of standardized regulatory requirements. Once we started the process of trying to develop this manual and this sort of reference material for people who are working in the sector to refer to, what we started discovering was that actually there are statutory instruments and certain laws that are in place that offer opportunities for us to obtain waivers and fast track import permits for some of these commodities, which people were unaware of. So once we got all the stakeholders involved, the regulatory authorities, which are the regulatory authority that deals with medicines and medical supplies, and also the Zambia Revenue Authority, which deals with duty and taxes and all these customs processes together, we were then able to streamline what that document would look like, so that everyone in the sector is able to pick up a document that will guide them on how they are going to go about the processes. So you'll find that there are certain things like high duty tariffs, which I saw listed there on as one of the challenges. What you end up discovering is that if, in our case, what we discovered was that if your commodity is meant as a donation or it's meant for the public sector, you are not required to pay any customs fees. Again, these requirements might be different from country to country, but you may find that there are certain leeways that have already been put in place by the law, and the various entities that are managing these legal regulations usually do know how to classify the commodities. So we might be helped by bringing all the stakeholders together so that we can try and understand the best of practice. On the issue of documentation, I think what we do from our end is that a consignment should not even depart from its origin before we've received all the documents. So we'll receive all the documents, we'll review them, make sure that they are correct, and they basically speak to the consignment which is on the way. So in brief, I think for the Zambia situation, you'll find that a lot of these challenges were made easier because there were some laws sitting in various with various regulators which already took care of what was of the main issues. So all we needed was to bring everyone together and develop this tool. So we might want to do a similar approach, maybe in other countries as well. If it's possible, we can sit down with these regulators and then see how best we can develop some sort of guide to ease the process. Thanks.
Thank you very much, Bright, who pursue that and probably see if there are any documents, and probably in future we can also have a broader platform to share the lessons and any documents that can be shared. So going to the next person, I'm going to direct this in two parts. The first one would be to one of the service providers who have been going around with commodities and samples all the way from COVID. And I'll also take the second part to one of the distributors or channel partners, just to understand how they have navigated the customs clearance bottlenecks to ensure continuous service delivery. So the first part of the person I will kindly go to BioCare, who have been moving the samples for Africa CDC for some time. I saw Elisha is in the house. Mr. Elisha, would you want to share with us how you have been navigating these customs clearance processes across the different regions of Africa? And if you have, any good practices that you would like to share and advise the countries to adopt. Elisha, please, Mr. Maharaj.
Thanks. Thanks so much, Nyansha. I appreciate the opportunity as well. Can I be a little bit naughty and maybe just go back to your previous question before I tackle this one? In terms of BioCare's experience and shipping across Africa, I don't think we will get to a stage where we can have a standardized approach in terms of clearance and risk mitigations. But what I think is a good recommendation is for us to create a framework, so a regulatory and compliance framework across all the different participating countries that details exactly what's needed from the documentation perspective to the transportation to the customs clearance pieces. And that can be very easily done if you've got experience in country personnel or representatives to be able to support with that. I think in addition to the framework, you would also need to have a very detailed workflow process in terms of the timelines and what's required before you even move a shipment. And then just to go on to your next question in terms of the customs clearance bottlenecks, I think, from the clearance perspective, there's certainly at least about 4 different risk mitigation strategies that can be implemented to try and reduce some of the clearance bottlenecks. Firstly, you would have to start off with a very, very clear document review process. So with a very thorough understanding of the commodity itself, that all of the documentation has been quality checked before you even get to the customs clearance process. Because in our experience, if there are errors on the documents in terms of your HS codes or a duty exemption not being in place in advance, you will certainly experience those bottlenecks. So ideally, your document pack needs to be reviewed. And also at your customs clearance point, you need to have experienced personnel handling the clearance process with your customs officers in country. So whoever is handling your clearing process needs to not only understand the commodity, they need to understand the HS codes, they need to understand the commodity itself, they need to understand the temperature control. I think having a very clear, concise understanding of that, they will be able to answer any customs clearance questions that may arise from a customs official who has very little understanding of the actual products that at that point undergoing clearance. And I think that's what makes a difference in terms of streamlining that and reducing some of those bottlenecks. Thanks, Nyansha.
Thank you very much, Elisha. I'm not sure if I saw someone from Illumina. Was it Madam Bridget? I'm not sure if she's still in the house to give us their side of the story as well as a manufacturer slash channel partner, or do we have someone from ISN? Oh, I think they've dropped. I saw Bridget getting into the house. I saw Dr. Sarah. Dr. Sarah from Africa CDC. Do you have something to comment from the 2 points? Sarah?
Yeah, thank you, Yasha. I don't think I have anything much to add at this particular juncture. Yeah, over.
Okay, thank you. I also see that we have Vivi in the house from Illumina. Do you mind to share some experience as you are moving quite a significant number of commodities across? Vivi? Sorry for putting you on the spot. Go ahead, Mr. Silva.
Yes, thank you so much, Nyasha, and thank you, colleagues who have made a contribution. We've been taking notes of some of the potential solutions. So I would like to pick it up from what Elisha raised, where she said that it's generally difficult to come up with a single kind of step-by-step process or manual for all the countries, but maybe approaching it from the point of considering a kind of framework that countries can benchmark on. And my understanding of this framework is that it's a kind of framework at maybe at continental level. So maybe I wanted to ping on this and say if we are to consider this as an actual solution where most of these detailed workflows will be embedded in that framework. I'd like to request Sarah, is this something that we could consider doing from the Africa CDC perspective? What would be the potential step-by-step process we'd go on with to see that we propose this and draft it? Are there any potential points you can share with us, such that as we live here, we have ideas on how to move forward? It's just a general question to Sarah. Thank you.
Yeah, thank you, Steve. I've been having some issues with the network connectivity. If you could just rehash the question again.
Yes, Sarah. So I was saying that there's a proposal that one of the possible solutions to address the issues of documentation and fast-tracking customs clearance processes is to develop a framework that provides details of these workflows for customs clearance. So my question was, from the Africa CDC point of view, would you suggest or give guidance on some of the steps we may need to consider to possibly start this process if we are to make a recommendation to move forward with developing this framework?
Yeah. So I think thanks for that. I'm trying to wrap my head around the possibilities as we can do as a public health agency of the continent. I believe we are well positioned to convene. Maybe I would say subject matter experts to see what what needs to be itemized actually in this framework, because of course we do understand the heterogeneity of the customs process across the continent, and is perhaps not something that is within our prerogative, but of course creating some kind of a document that can offer some level of guidance as a framework, as you're saying. Yeah, so we can be able to the step-by-step process, of course, is to identify the key players across the document that will at least serve as a guidance to the member states regarding that.
Right, thank you so much. Over to you, Nyasha.
Thank you very much, Sarah. Do we have anyone else who wants to contribute to this item before we go to the next and last item? Thank you very much. So at the end of the day, we would want to have best practices that we can probably adopt in our different environments, in our different countries, based on the advice that we had. So as CoP members, we need practical solutions that we can propose to fast track and probably address these bottlenecks. So I have put up a summary of the good practices that we have seen in some interventions, including what we were discussing as I was jotting the notes here. These are some of the interventions and practices that we have seen across the countries and even had today. Implementing simplified and accelerated clearance processes, like pre-clearance of shipments in advance and the risk-based clearance approach. Leveraging technology for efficient processing, like real-time tracking systems, as well as automated customs processing, where the shipments, the consignments are tagged in systems for the customs clearances. Then building capacity among customs and health officials. There are some countries that now have their in-house laboratory people trained on customs so that, like what has been mentioned before there, we have people who are competent enough and who understand these systems, also attending even trainings and workshops on tax clearances and customs, so that, as Brighton from Zambia was mentioning, that some of the items that are supposed to be duty-free, sometimes you may not know the codes if you are not part of the system. And this, of course, includes technical skill development. Then establishing prioritization policies for health commodities in terms of having the medical shipments with probably Greenlands, where they've got a special route for clearance, and regional cooperation and policy harmonization, as Elisha from BioCare was mentioning, that though we may have different SOPs for different countries, but we need an overarching policy and to sort of guide the harmonization of how the commodities move. Thank you very much, Dr. Sarah, for mentioning that. With time and engagement, there might be a way of having something that is harmonized across the different countries in terms of how we move and receive the commodities. The commodities are very special, and given the low levels of local manufacturer, importation remains a big item and subject, as we discussed on the first slides. And it is important for us as a house now to suggest, in the presence of SLM, in the presence of Africa CDC and other stakeholders, to suggest how we want to have a way forward, and to suggest steps that we think will take us there in terms of simplifying the customs importation of commodities that are critical to the health for the genomic sequencing, as well as other related tests. So probably to break the ice, I will kindly ask Trevor from CHAI, and I also saw a very experienced colleague in the house, Newton Renyoa. You can come in after Trevor if you have any suggestions about steps that we should take on this clearance. Trevor.
Thanks, Nyasha. You know, I'm not a clearance or logistics expert, but I really did appreciate the clear thoughts provided by Alicia earlier. Obviously, coming from an organization that does logistics day in and day out. So, you know, I do think that we as a community can it's a good practice to learn from experts and adopt some of the best practices there. So I would just say that if we maybe as a follow-up can get even a little bit more information from Alicia and her team, specifically around how they manage logistics day in and day out, specifically around each of these items that you've highlighted here, that would be my recommendation. You know, I'm not an expert in this field, so my suggestions are really about where to go to get the best information. Thanks, Nyasha.
Thank you. The floor is open to the other housemates about any suggestions from the challenges that we've received. Now moving towards solutions. Any suggestions or challenges that we want to give to potential authorities who would handle this in their presence? It's open. The floor is open. Go ahead, Elisha.
Thanks, Nyasha. I think just in response to Trevor's comment, from the BioCare perspective, I'm more than happy to take some of this back and we can dissect a little bit more in terms of our process. Just looking at your slide deck, you've got it nicely broken down. But even I think before the pre-clearance steps, we could advise on document review, quality checks at that level, before we even approach the clearance. So certainly happy to contribute where we can in terms of providing more detail on some of these points that you've highlighted here. Thanks.
Thank you. Mev, go ahead.
Yeah, just a couple of comments. One, again, I think it's important to understand which part of the importation process is where the challenges are and where the specific interventions are needed. So what I see here is very much, it seems to be very much around the majority seems to be around the customs processes. I know that from the previous workshops, what was raised is that the HS codes were not always accurate, and so that created problems. It sounds like that in situations where tax waivers are being required, they're taking a long time because of those internal processes within the government as opposed to within the customs. So that's another thing. I think also one of the big issues I understand as well is that because products come in under different Incoterms, so you have some stuff that's being donated by a manufacturer, donated by a donor, and they may have different Incoterms, which basically means that who covers customs and who covers clearance can vary. Also as well, whether products are procured by the labs or procured by others also has a variation in the Incoterms. So for me, the standardization around the Incoterms is also quite critical. So again, I would suggest that I think that there's different areas depending on where in the importation process it is, and there's different actors. So it's not all just about, trying to talk to customs agents and customs regulators and get alignment with them. There is alignment that's needed in other parts of the internal national processes as well as paperwork requirements and so on and so forth. So I would suggest a focus on the HS coding. I would suggest, well, actually, a lot of work had been done on this in the previous workshop that was held in Ethiopia, and out of that, there was several solutions that were recommended, and these were developed by manufacturers, distributors, labs, some regulatory people, and all of that. So I would suggest taking those back out and looking at those again. There was also an advocacy note that was developed and that I believe is currently at the Africa CDC, not clear where that's going, but that's also supposed to be aimed at addressing some of these issues. And I do believe that there is some discussions around trying to understand how to engage with various regulatory authorities to see how we can streamline the processes and so on and so forth. Also, as well, the Clinton Foundation is working with the Gates Foundation on alternative procurement models, which is about changing the Incoterms, and a part of that is aimed at trying to streamline these processes as well, so that those risks and those processes can be handled more upstream. So if there's any questions or comments, please feel free to reach out. Thanks.
Thank you very much, Mayor. That is a very interesting side of it that why are we worried? If only we could all import our commodities, probably moving them direct to the laboratory from the manufacturer or supplier. I see we have got Johnson in the house. Dr. Johnson, from a procurement perspective, what would stop us from having everyone receiving commodities direct as DAP direct to their doorsteps, or what do you foresee? Why is it that sometimes we've got doorstep delivery, sometimes we've got items being delivered at the port or by the border? If we're going to ask to have everyone doing the same delivery to the doorstep, what would we need and what challenges would we foresee? Over to you, Dr. Johnson.
Okay. Thank you so much, Mr. Tole and colleagues who have brought brilliant points. So I think the issue of the DAP is many issues around it. First, you also look at it from the point of financing, from the donor perspective, for example. So when you do DAP, it means the cost of the commodities will be on the high side. It means you are going to use more funding, part of which we also take care of the in-country customs clearance and duties and so forth. So in terms of impact, it means part of that money will go towards the duties and taxes. So from that perspective, it may not be a palatable solution to some of them. And then you also look at it and say, for a supplier to do a JP, they may not be fully conversant with the in-country regulations. I think it's a point which Elisha spoke about, to say they may not know what happens in Zimbabwe. So they may be afraid to go a DAP route. They would rather pursue a CIP. If they chose to do that, they would put a precautionary pricing on it, which is more than realistic pricing. And then when you look at the whole concept of Incoterms, there's also issues around engagements of government departments, because they are misaligned in terms of their objectives. For instance, you may have two government departments managing these issues of customs. You may have Minister of Health doing its own part. You may have Minister of Finance, but the two are not really, there's no nexus between the two departments. Their objectives are quite divergent. So it may further compound this issue, though the general preference would be to have a loaded Incoterms like a DAP, but it comes with these other dimensions. Thank you, and over.
Thank you very much, Dr. Johnson. Dr. Sarah, I saw your hand was up. Do you want to say something shortly as well, Reba?
No, not really. I just wanted to just put it forward that we, as Africa CDC, are also working on advocacy news. I think this was mentioned during our inception meeting. And yeah, I think during our next iteration, we'll be delving deep as to what we really want this to address, to help in streamlining the genomic surveillance supply chain in the continent. Thanks, and over.
Thank you very much, everyone, for the active participations. As we wrap up, I won't necessarily run a poll, but I ask you to show by raise of your hands if you agree to this proposal. If I get a majority, I will pass it on to Africa CDC as a challenge. Do we think that it would be something worth to pursue if we're going to assign Africa CDC to take the responsibility of negotiating or liaising with the different countries for a smooth movement of genomic sequencing and other related commodities for both the research and diagnosis in the different countries? Is this a challenge that we think, whilst we are doing other things, we can also give to the motherboard Africa Union through Africa CDC? Those who agree with that proposal, we may just show by raising of your hands. If we see many hands, then we will take it to the authorities at Africa CDC that you have been challenged today by the community. Silva, can you help me to check if we have got significant hands that would warrant Madam Sarah to take this back to the elders.
Yes, thank you, Nyasha. As colleagues put up their hands, we encourage colleagues to join our WhatsApp page. We have put the link in the chat, and also the survey. Please get a few minutes and try to respond to some of the questions, some of the things we are discussing here to get more clarity. We have just a short survey that we have posted in the chat. And also to highlight that this same meeting, hopefully you already have the invite in your email. Our next meeting will be in a month's time, in the last Wednesday of the month of March. So we'll come up with another topic and then we'll share it and then we'll discuss further and share some of the updates we shall have made progress on. Thank you.
Thank you very much, Silva. From the look of things, I saw a significant number of hands. So, Dr. Sarah, on behalf of the community and as the moderator today, I politely ask you to take back this message to the elders at Africa CDC that we challenge them and we are willing to, the community is willing to work with them so that they can lead where possible in the different countries for us to get a green route and an easier way of importing commodities for the betterment of health research in the future. On my own behalf and on behalf of all the organizing teams from ASLM, from Africa CDC, from CHAI and from the Girls Foundation, I really appreciate your participation and we look forward to meet you in the next meeting. Thank you very much.
Thank you. Bye, Nyasha. Bye, everyone.